All right, joining us now to talk about that, we have Dr. Hiral Tipirneni. She's an emergency medicine physician. She's with us to talk about the latest COVID news and also the push for Americans to get fully vaccinated. Welcome to BNC Live, Doctor. It's a pleasure to have you. All right, so tell us exactly. Yes, thank you. Tell us exactly how you're urging your patients who were not vaccinated to roll up their sleeves. What more can we say at this point?
Yeah, that's a great question, and it's such a critical time. Here in Arizona right now, we have just been given advisories by the leaders of all of our major hospital systems, noting that community spread is incredibly high. Hospitalization rates are at their highest since the pandemic began, and we're depleted. Resources are depleted. Staff and personnel are not there to man. If there is even an empty bed. And this is a year after we've had a vaccine that is highly effective and available widely and free. And that's what makes it so frustrating and exhausting for healthcare workers across not just Arizona, but across the nation. And so we keep reminding folks, look, it is clear that at some points, even 100% of those that are hospitalized with COVID are unvaccinated folks. We know that the vaccine works. We know that it's not supposed to prevent anybody testing positive. It's not supposed to prevent having mild symptoms, but what it does prevent is serious illness. It prevents you from ending up in the hospital with serious complications. It prevents you from having to be intubated and be on a ventilator. It prevents long-term COVID complications, and it prevents further spread in our communities. So it is so important that everybody who is eligible, which is everybody now over the age of 2, can get their vaccine, become fully vaccinated. And if you are eligible for that booster, meaning if you're 6 months out, please get your booster shot, because we know that immunity wanes and we want everybody to be fully protected.
Doctor, it seems like every milestone we hit, we're shocked. Once we hit 500,000 lives lost, we were all shocked. Now we've reached 800,000 lives lost, and it's like folks seem to be complacent. Do you think it is a possibility we could actually see 1 million lives lost to this virus despite having the tools right now?
It's absolutely possible. I mean, I remember when we hit 10,000 and everybody gasped and thought, that was a huge number, which it indeed was. I mean, 800,000 is astronomical. It's heartbreaking. Think about all those families that have been devastated. And remember, those are just lives lost. We have hundreds of thousands of more folks who are living with long-term COVID-related complications. We have collateral damage from that too, because remember, when you have hospitals that have to go on bypass, they can't see patients that need to come into that hospital, that ER. They are pushing back or delaying elective surgeries. That means people coming in with heart attacks and car accidents and pneumonia and things like that. I mean, there's a real concern about them receiving the care in a timely fashion, only because there are not the number of beds and the amount of resources and personnel available to care for them. This is a very serious concern. And so when somebody says the vaccine, me getting a vaccine, it's my personal choice, remember that that choice impacts everyone around you, your entire community. And I don't want us to get numb to this number. 800,000 lives lost is beyond tragic, and we have to be mindful. This is not behind us. We are very much still in the thick of things.
Yeah, absolutely. And speaking of that, we got about 20 seconds, actually less than that. So I'm sorry, I would ask you the last question. Are you concerned about the holiday approaching and folks traveling?
I am. We want people to gather with their families, but we want them to do it safely. So be mindful, know that, who you're with is fully vaccinated. If you're going to be indoors, please wear masks, try to stay outdoors if you can, if the weather allows. Make sure you're in adequately ventilated spaces. Just practice all the public health measures we know are important. And most of all, make sure you're fully vaccinated, which includes your booster.
Yeah. Dr. Tipirneni, thank you so much for stopping by and talking with us. We appreciate your time.